Prostate enlargement. Hello and welcome back to Whole Health. Today, we're tackling a topic that affects almost all men at some point in their lives: prostate enlargement. Did you know that 90% of men will experience prostate enlargement in their lifetime? If you're noticing changes in your urinary habits or you're simply curious about what to watch out for, this video is for you. In this video, we'll cover what the prostate is and why it gets bigger, 8 key symptoms of an enlarged prostate, the critical warning signs that could indicate prostate cancer. By the end of this video, you'll understand the difference between benign prostate enlargement and prostate cancer, and you'll know exactly when to seek help. If you're new here, don't forget to hit like and subscribe for more health tips. Let's get started. Please always contact your doctor for any medical health decision because this video is just for informational purposes alone. Now, let's talk about the prostate. What is it and why is it so important? The prostate is a small gland found in men, about the size and shape of a walnut. It sits just below the bladder and surrounds the urethra, the tube that carries urine out of your body. Its main job is to produce the fluid that mixes with sperm to create semen. This fluid helps nourish and protect sperm during reproduction. As men age, it's common for the prostate to grow larger. This natural enlargement is called benign prostatic hyperplasia, or BPH. BPH is not cancer, and it doesn't increase your risk of developing cancer. However, the symptoms of BPH can overlap with those of prostate cancer, which is why it's so important to understand the difference. Let's break it down further, starting with the symptoms of an enlarged prostate. An enlarged prostate can lead to a variety of symptoms. These symptoms range from mild inconveniences to more serious complications. Here are the 8 key signs to watch for. Number 1. Frequent urination. Are you finding yourself rushing to the toilet more than often than usual? This is called increased frequency and happens because an enlarged prostate presses on the bladder, making it more sensitive. Number 2. Sudden urges to urinate. Along with frequency, you might feel an intense, sudden need to go. This urgency can be difficult to control and is another common symptom of prostate enlargement. Number 3. Waking up at night, nocturia. Interrupted sleep due to nighttime trips to the bathroom is one of the most frustrating symptoms. Many men find it disrupts their rest, leaving them tired and irritable the next day. Number 4. Difficulty starting to urinate or hesitancy. If you find yourself waiting longer to get the flow started, this is called hesitancy. It's often due to the prostate narrowing the urethra. Number 5. Weak or slow urine flow. That strong steady stream you used to have may now feel weaker or slower. It might even stop and start midstream, which can be frustrating. Number 6. Dribbling after urination. Some men noticed leakage even after they've finished. This can be embarrassing and is often caused by urine left in the urethra. Number 7. Feeling like you didn't empty your bladder. You may feel like there's still urine left, leading to repeated trips to the toilet. Number 8. Complete blockage or pain, or urinary retention. In severe cases, the prostate can block urine flow entirely. This is called urinary retention, and it's a medical emergency. Symptoms include a painful, bloated abdomen and the inability to urinate. If this happens, seek medical help immediately. What causes an enlarged prostate? The main factor is age. As men get older, hormonal changes play a big role. Testosterone, a key male hormone, gets converted into a more potent form called dihydrotestosterone or DHT. Over time, DHT can stimulate prostate growth. Another factor is estrogen, a hormone usually associated with women. As men age, their testosterone levels drop, which can lead to relatively higher estrogen levels. This imbalance may also contribute to prostate enlargement. It's also worth noting that lifestyle factors like obesity, metabolic syndrome, and even genetics can increase your risk of developing BPH. Warning signs of prostate cancer. While most prostate enlargements are benign, it's crucial to recognize the warning signs that could indicate prostate cancer. Here are the key red flags that doctors look for. Block in urine or semen. While this isn't always cancer, it's a symptom that should never be ignored. Unexplained weight loss. Losing weight without trying is often a sign of a serious underlying condition, including cancer. Night sweats or persistent fever. New drenching night sweats or unexplained fevers can point to cancer that has progressed. Bone pain or back pain. Advanced prostate cancer can spread to the bones, causing pain in areas like the ribs, spine, or hips. Erectile dysfunction in late stages. While less common, difficulty maintaining an erection can occur as a later symptom of prostate cancer. One of the most challenging aspects of prostate health is that BPH and prostate cancer can look very similar. Both can cause issues like weak flow, frequent urination, and hesitancy. However, prostate cancer often comes with additional symptoms like blood in the urine or semen, unexplained weight loss, or persistent pain. Ultimately, the only way to know for sure is to consult a healthcare professional. Your doctor may recommend a PSA blood test, a digital rectal exam, or imaging studies to determine the cause of your symptoms. If left untreated, an enlarged prostate can lead to complications, including bladder damage. Constant pressure on the bladder can weaken its walls, making it harder to empty completely. Kidney damage. Urine can back up into the kidneys, potentially leading to infectious or even kidney failure. Acute urinary retention. As mentioned earlier, a complete blockage of urine flow can become a medical emergency. So when should you seek medical advice? If you're experiencing any of the symptoms we've discussed, especially frequent urination, weak flow, or blood in your urine, it's time to book an appointment with your doctor. Early diagnosis can make a huge difference in both treatment and outcomes. The good news is that there are plenty of ways to manage prostate issues. Treatment options range from lifestyle changes to medications and even minimally invasive procedures. Simple lifestyle adjustments like maintaining a healthy weight, eating a balanced diet, and staying physically active can help reduce your risk of prostate problems. Prostate health is something every man should take seriously, especially as they age. While an enlarged prostate is common and usually manageable, it's important to stay vigilant for signs of something more serious, like prostate cancer. If you're dealing with any of the symptoms we've discussed, don't wait. Book that doctor's appointment. It could make all the difference. If you found this video helpful, please hit like, subscribe, and share it with someone who might benefit. Thank you for watching, and take care of your health.